Over a number of years, I developed osteoarthritis in my knees and a number of other joints as well, but my knees were the main concern for me because of obviously mobility. I'd always considered getting a total knee replacement at some point. However, I put it off because of the fact of being advised that the longer you leave it, the longer the knee will actually last. So it's been over 10 years or so since I've been putting up with it, and it's degenerated so much to the point that I really had to do something about it. So I arranged to meet with an orthopaedic surgeon and discuss what my options were as far as getting the total knee replacement done in both knees. I had considered getting both done at the same time, but it was advised that probably not a good idea, seeing as you would be pretty much debilitated for quite some period of time. So we agreed to start with the worst one, which was my left knee, and see how that went. Probably give it at least a 3-month break or so in between before looking at doing the right knee. Now, in my situation, I had bone spurs on both femur, tibia, and behind the kneecap as well. So I didn't have much meniscus left or cartilage left, and it was almost bone on bone. The left one having a very small compartment where the synovial fluid should be. And that was decided to be the first one that would get replaced, and then we would do the right knee a little bit further on down the track. So with all that said, we were thinking, well, okay, if we get this done now, it's going to take me about 3 months recovery, and in that time we booked to go back to Bali. And so the race is on to some degree to get myself prepared, up and running, well, not running so much, but walking at least, and being able to climb stairs and just be a little bit more mobile in regards to travelling around Bali. So that was the whole idea of the time frame. So we're on a race to get myself in a situation where I can maneuver myself without too much great assistance from crutches or anything like that, and be able to be standing on my own 2 feet, so to speak, and get back to Bali for another stay there. So that is what we're aiming to do, and the race is on. So I've documented the process, and this is what happened. So I hope it's of some use to you if you're considering getting a knee replacement done. It just goes through the process of the surgery and the rehab in particular as to what you might find is going to happen. So let's have a look and see how it goes. Knee replacement surgery is a procedure whereby the knee is resurfaced, the damage is removed, from the arthritic damage is removed. Metal and plastic parts are used to cap the ends of the bones once the bones have been cleaned off, and I must say I did hear the angle grinder being used during my operation. You are given a general anaesthetic as well as an epidural anaesthetic, which totally causes the lower part of your body to numb completely right out. But at some parts of the procedure, you may find yourself slightly awake, and the angle grinder, or the grinder that they use, is quite noisy. So I was aware of that, but it didn't hurt, didn't feel a thing. And then metal and plastic parts are used to cap the ends of the bones that form the knee joint, along with replacement of the kneecap. Not quite Bali Mandara, but the paint colour is very similar. This is inside Rockingham General Hospital, where I've just had my knee replaced one new knee. And that creaking is the bandage, not the knee. Although, you never know, it might creak at some point. There's no guarantees it's a silent knee. All functions so far so good.
How's it feeling?
Oh, it feels wonderful.
That's
feels
good.
Like a brand new knee.
Day one?
No, day half, really, 18 hours.
Yeah.
It's been since the operation.
And your lunch has just arrived, so
Lunch has arrived.
that'll be
I forget
interesting.
what it is. I think it's poached fish.
And the dressing's just come off.
To reveal.
It's like a
Oh my
fish
God.
and potato pie.
Ooh.
Oh, who knows what I ordered. Yeah. No worse than usual. I did feel when I stretched out a little bit from the incision.
Yeah,
That's to be normal, but it's more so around the quad area on the top.
right.
Feels like, like
That's
you've
normal.
overworked it.
Yeah, a bit of an ache. It just
Yeah.
feels a bit tight.
All right, so
Continuing your documentary.
what do you have here?
This is lunch. I'm not sure because I think I asked for poached fish.
It's very
But it
colourful.
Could be a fish pie. with
It'll probably taste
potato,
nice.
potato leek, and fish pie.
And some
Being fried.
bread and butter and a creme brulee,
Creme
which
brulee, which is all creme.
seems to have forgotten its
Brulee.
But anyway, oh well, enjoy.
So we're now 36 hours in, still painful. Medication helps, the heavy duty stuff helps a bit. Panadol does nothing. Had nausea and a low blood pressure for a while. So it just comes and goes. Unfortunately, but hopefully I'm still going to get out of here today. It's a stinking hot day outside, so that's not going to help me at all. Lucky we've got air conditioning at home.
No, you're good. Can I just, before you do that, can I just do your observations?
Yep, of course.
Just go step in the because if they come and get you, I don't know what the theatre list looks like today. I can ask them myself.
We have a minor setback. The doctor just came in to release me and bent my leg and it popped. So could be another 2 days here. So what happened was there's stitches underneath the skin surface, so there's no stitches on the outside, unlike down that one. So it gives you a cleaner scar, however, and they put a glue strip across the top, and that's what broke under pressure when he pushed my leg back to see how much extension I had. So now we have a new dressing and a new crepe, or a number of crepe bandages on it to stop it from flexing, and see how it goes tomorrow. But most likely the doctor thinks it would be Monday before I get released now. So that means a Thursday, Friday, Saturday, Sunday, Monday.
Okay, so I'm at the hospital thinking I was coming in today to pick Derek up and take him home. And just as the doctor was about to discharge him, his leg wound started to bleed heavily, and now it looks like he's going to be in hospital for another 2 to 3 days. Great, but at least he's in hospital and it didn't happen at home. So how are you feeling?
Oh, I'm feeling wonderful now that I've had my ketamine
Capsule?
capsule
I wonder what that's
type
gonna
thing. I'm assume there's something like morphine.
Okay, so now he has his leg heavily bandaged and with 2 packs of ice to stop the swelling. And they've put some socks on him because his feet were cold. And the coffee shop's downstairs is closed today, so I've just had to buy him a can of Coke Zero. And he's just had a ketamine and he should be laughing. He's not really laughing now that he has to stay here a few more days, but
It's that swollen area, which is where the blood's drained into. They have to drain it out through this magical thing. As long as that's green, it's fine.
all right. So here we are, back at the hospital again. Well, I'm back at the hospital, he hasn't left. What's that thing you've got on your chest there? What's that?
That is a pump that should be down inside here. Pumps out blood
From your knee?
from my shin actually into a gauze bandage.
And what's that thing on your arm, on your hand, wrist?
That's a cannula.
What's that for?
They put antibiotics in it.
Right. How are you feeling?
I'm feeling on top of the world.
I just noticed that you got up and had a little stroll
Well, I have
on
to get
your
up and have a walkie.
on your walker, which is there. So are you finding the walker easier than the crutches?
Yes, I do.
Are you allowed to
Just
take?
to go here and there, yes.
Will you be taking the walker home with you?
No. Would.
Well, I hope it's a huge success walking out of the hospital with crutches.
And you'll be there to catch me.
No, good luck with that. Okay, so here we are about day, what, 3, 4? Day 4, he's still in hospital and he's just got this yummy lunch. I'll just show you close up.
We have peas. On this side, you've got maggots. Oh, that's rice.
And what's that big lump of,
Oh, that's where I was sick.
oh my God.
It's chickpea. I think it's chickpea.
It's a sweet vegetable curry actually, but anyway.
Nothing sweet about it.
And then this is the situation today. He has a battery operated pump which is taking blood out of his knee, and
From that little recess
yeah,
there.
because there's a hole in the thing. He's got ice underneath,
We call it a cavity.
a cavity. Well, anyway, so maybe home tomorrow, do you think?
Not after I eat this, I won't be going
We might
anywhere.
have to stay in for another week.
The little battery pump is in fact working, so I'm told.
Is this going to be the final meal of my time in hospital? Day 4, I think I'm up to after surgery, so that's 5 days in hospital. Monday going into Tuesday tomorrow, when I'm hopefully going to be released. All going well. We've got pumpkin soup, we've got chicken and mushroom in a creamy garlic sauce. And the best part of it is probably the ice cream. Let's enjoy that.
Day 5 after surgery, and we're allowed to go home. We've had the inspection today. That's fairly stable, as they call it in the trade. So I'm allowed to go. And this little pump's doing its thing still, just drawing out whatever fluid is around that area. And hopefully all should be good.
So Derek, what's
Yes,
happening
well,
today?
we're
This
gonna
is
have
1
a-
week later.
Vacuum assisted bandage. Here, which is connected to the battery pack. We've gone through that before. We're going to have that changed because it's drawn out most of the fluid. It hasn't moved in the last day or two up to that level, and as you can see that's dried out. And so that seems to have done its business. We'll take that off and we'll assess it, doctor. And what my doctor said outside was we'll put another one of these on just to make sure that we're getting the vacuum compression
Okay.
onto the wound. So there might be another one with a bit more blood coming through.
But it's only been a week and they think you're doing
A
well.
week and 1 day and I'm doing, hey,
Good.
time to change that yucky dressing. It's been, what did we say, 5 days, 6 days it's been on, and it's done its job. It's sucked up the blood.
It's made clean and
Have you got a pico dressing in here?
no, oh right, because I wasn't
I'll go and
sure.
get it.
Are they?
Now it is impressed.
We're up to day 10 post-surgery, week and 3 days in. So this is the new dressing from Friday. So that's 3 days it's been on, and it's drawn out just the tiniest little bit down there. So the vacuum pump is still doing its business on there. It still feels very tight on there. However, one thing that I can actually do as of today, look at that, I can lift my leg up. Hurts though, but I don't want to do it too many times because it does actually hurt in there. But that's the first time in 10 days since the operation that I've been able to lift my leg up, which is one thing I was thinking I'm never going to be able to do again. It just had a paralysed feeling, which is what the surgeon said. Your leg is basically paralysed because we've cut the muscle in half and cut through the nerves, and they have to rejoin and fix themselves. So a few exercises that we've been doing to get the bend happening has now enabled me to get at least an inch off the ground, or in a flat reclining position, an inch off the chair at least. So that's a good thing. The update so far, it's been 11 days post-surgery, and this vacuum assisted bandage has come to the end of its life. Unfortunately, yesterday the pump stopped flashing okay, or would normally flash green, and it's completely stopped and I can't restart it. New batteries, the whole thing, I've tried that, nothing works. So what that has done is obviously stop the vacuum pump from working. It's drawn out just a little bit, it hasn't really moved much since yesterday. I've contacted the hospital and they're going to ring me back, hopefully. The downside is that it's recommended that you take these vacuum pumps off
because they're obviously not doing anything, and they can maybe cause infection. So I'm waiting on the hospital to get back to me to get a time to either get a redressing on it or something that will fix it. But in the meantime, I'm getting a lot more use out of the quadriceps, and I can bend it a little bit easier, and almost 90 degrees there. And so it's going along quite nicely, apart from the fact that the pump has stopped working on me, and we're starting to see a lot of the swelling going. If you compare the left and the right legs together, they're almost similar. There's still a little tiny bit in the left leg. There's probably a bit more around the actual knee area for the swelling, but we've been using a lot of ice every day, and that seems to be doing the trick. And that is pretty much today's update. Thanks for watching our videos.
Please like and share them.
Also, please leave a comment.
And most importantly,
Don't forget to subscribe.
We would really appreciate your support.